I'll start by introducing the first paper, which is Strengthening Urban Wash Service Delivery, Evaluating the Role of SJZs as Jalasathis. That's going to be presented by Anurag Antony, who has 15 years experience working in association with local governments. His key areas of expertise include statutory master plan, sanitation, transport, and heritage. He's working with UMC, and along with him will be presenting Archana Goswami, an environmental planner working with UMC. Thank you.
Thank you, Melissa. All right. Thank you. I hope everybody had nice tea and the snacks. I really like the kachori, mini kachoris. I had too many of them. But nevertheless, just a quick poll. We have about 15 people as I see. How many of you have received an SMS as a reminder to pay your bills from your mobile network provider in the last 3-4 months? Just raise your hand if you have received. Fantastic. How many did not pay? Raise your hands. You did not pay. Okay, late payment. That's me. That's most half of the time my bills go late. So, but I think 80% of you have received an SMS, and out of that, almost everybody except for one or two people pay their bills on time, right? Now, imagine if you didn't get the SMS, would the number of people not paying increase? Do you think it will increase? Yeah. And do you think if that happens, you will still have 24-hour mobile connectivity? Airtel, Vodafone, Jio, whichever network you are on. Would you still have 5G for 24 hours a day with the same bandwidth in every nook and corner of the city or even the country now? Right? I think the answer is no. But then when we draw parallel to the water supply network, unfortunately the story changes. I, in my life, have never received any SMS reminding me to pay my water charge. How many of you have received a message from your water service provider to pay your water bill? Show of hands. Sorry? Can you count the bill as? Um, yes, I do get my bills from Airtel also, but you get the bill, but it is more about the nudge, a reminder. Do you get a reminder in any form? Maybe not an SMS, but in any other form for your water bill? Oh, you do? All right. We'll take that story in Q&A. Sorry, your name? Vasu. I'll come back to you, definitely. But uh, the fact of the reality is, for our mobile networks, our life stops. If we don't have it for half an hour, we'll be doomed. But if our water stops for 22 hours a day, we are okay because we're getting water for 2 hours. And if we pay, it's fine. If we don't pay, that too is fine, right? And this is a problem all across the country, right? And that's exactly what we're trying to solve. The lady you see on the screen is the SMS version of a reminder for water supply network. And she's called Jal Sathi. Now, you can get text messages for water bills also, but how effective will it be for what kind of demographic? How often do you get it? Does it get lost in the 300 SMSs we all receive every day for credit card, for shopping, festivals, and OTPs? But this lady will visit you once a month. She will tell you about your water bill. She will ask if you have any problems with your water, and she will also collect the money. And that's the story of Jal Sathi. Next. So Jal Sathi program was an initiative by the Odisha government and started in 2019, where they were also facing the situation that we spoke just a minute ago. And what the Odisha government said is that we have a community members, these are self-help group members, all of them women, mostly in the age group of 20 to 45, who have basic uh, competence, ability to use a smartphone. They own a smartphone. And then we will make them into these Jal Sathis who are really friends, not an SMS reminder. In fact, SMS reminder is a bad analogy beyond this point. They are people who will come to your doorstep to solve any problem you have, beyond water also. And that's the story we'll very quickly in the next few minutes run through. And I'll request my colleague Archana to please give you the details of this.
Thank you so much, Anurag. And I think this was a very interesting start for all of us. And this is really a wake up call.
Hello, check. Sir,
Hello. Yeah. So I think this is really a wake up call for all the ULBs. We should think that we are getting SMS and the reminders for our mobile bill, but we are not getting it for our water bills, not even for property bills, I guess, property tax. So today we can just have a quick look at how the Jalasathi was incorporated and how it was implemented. So if we look at the journey of past 5 to 6 years, so the Odisha government, they started the Jalasathi scheme in 2019. And obviously they started with 5 ULBs, 5 to 7 ULBs to begin with. And the women's are attached to an SHG, so they were called, they were given training, proper trainings, and about how to use the machines and how to do the water quality testing. And then the pilot was run in 7 wards of Bhubaneswar only. Later on, it was scaled to other cities, Cuttack, Puri, Khordha, and Jatni. Then there were also the standard operating procedures which were prepared for this woman, because after they started going in the field, they faced many challenges. Then they also needed to remember how to use the MPOS machine, how to take the meter readings, how to use the machine, and how to generate the bill, then collect the charges. So all these things were included in the SOPs. So what UMC's role was in the scheme was to understand how the Jalasathis are working in the field, to do the assessment of the scheme, and to understand what are the responsibilities and what are the challenges faced by these women. Also, what are the challenges faced by the ULBs who are implementing the scheme. So when we look at the process, sorry, no, it's okay. So this is just visual photographs. So we have water meters in each of the household where the woman who is a Jalasathi, she is visiting. So she will take the meter reading, then she will use the MPOS machine to generate the how many charges the person, the owner needs to pay. She will also do the water quality test. So this is a community level water quality test, and it tests only one parameter, which is a residual chlorine. The results are conveyed to the owners along with the bill, and then they will collect the charges. So overall, if we look at the distribution, so there are about 10 lakh customers as of now. This is data for the last year. So there are about 10 lakh customers, and still 68 ULBs have more than 80% non-metered connections. So what they are doing right now is that the non-metered connections, they are also charged for the water consumed, but that is based on the flat rate charges. And the metered customers, they get a proper bill as per the readings. So if we look at the average monthly income of this woman, so this is a win-win situation for the woman as well as for the ULBs also, because the women are earning about 10,000 rupees per month, and the ULB is also able to collect the revenue, water taxes from the metered connections and non-metered.
And this is for about 4 to 6 hours of average. It varies
City.
by city.
Yeah. So on an average, a woman is allotted around 800 to 1,000 households to visit in a month. So approximately she is visiting 30 to 40 houses in a day, and the working hours are flexible. So this is a very flexibility and work conditions for her also. So to understand further challenges, we also interacted with different stakeholders. We had a group discussions, and then we came up with a knowledge portal, which would be useful for the capacity building. Anurag?
So, there were two parts to this. One was training of the Jal Sathi, the women itself. The other was training of the water service provider officials, engineers, and their supervisors. And there are numbers like 160 such officials were trained, 800 plus Jalsathi women were trained to cover 115 cities. The training modules varied from using a POS machine, collection of money, generation of bills, water quality testing, complaint registration, and so on and so forth. And there was a rigorous method to track. But the most important success factor out of this was the last line that you see. In 1 year, the revenue jumped from 65 crores to 72.5 crores. So 7.5 crores revenue jumped for water tariffs, water user charges, by spending approximately 40 lakh rupees in giving the remuneration to the Jalasathis. Now, this is not just about money. They also plugged in the water leakages gaps. There were leakages in the system because these are your field officers, 800 field officers in your city every day seeing taps, junction boxes, pipelines, and if any leak is observed, they report that. Any problem with the customer, they address that. So you have happier customers. People who were consuming water unabashed because meter readings were never being taken before that now are conserving water. So of course they are using it judiciously to save money, but there's an environmental benefit also that the resource is being utilized in a much better way. And at the end, of course, socially it's been really wonderful. You have happier citizens, you have happier climate, you have happier government officials, and you have women who are earning livelihoods. And a personal anecdote before we come to your story. When I met one of the Jalsathis in Bhubaneswar, she said, I did not tell my family I'm a Jalsathi for 6 months. And in that meantime, I could gather 40 to 50,000 in my savings account. And unfortunately, my husband lost his job after 6 months. And that's the time when I told him, and it really saved us. If I would have told him earlier, he may or may not have reacted well. I may not have been able to sustain. But there are numerous personal stories like this if you speak to these 800 women, and these are wonderful. And now, one last story from you. Sorry if you have exceeded time, but in case. Oh, so you're the guy we read about in the news.
Not really, and this is also what I realized. I work at
Yes.
Janagra, so
Okay.
we also visit urban local bodies, and one of the major contentions of people not paying their bills is because they never know what is their due. So,
That's true.
so that way,
That's
this
true.
model is very helpful. Yeah.
Right. Thank you so much. We'll be happy to take, are we taking questions now or at the end? All right. We'll be happy to take questions or feedback or suggestions. Um, so, yes, Mary.
Well, everybody knows the great work UMC has been
Thank
doing
you.
across, and especially in the state of Odisha. Exemplary work with regard to sanitation workers and this uh, particular piece. Just out of curiosity, wanted to know what impact did it have on the water supply as a whole in the state? Was that study been taken, or is there a potential? Because I'm sure NRW losses and everything must have been taken into consideration, or like as a result would have come up. So any inputs or any findings on that?
Um, I'm not sure about the evidence, but anecdotally, like I said, there are stories, there are testimonials, and Xerxes, of course, has been leading this initiative, so he has a lot of data. I'm sure there is some data around what have been the other benefits, positive unintended benefits beyond just livelihood and revenue collection. But anecdotally, yes, all of this is true. There has been reduction in NRW, satisfaction levels are high, meter connections have increased,
Yes.
bill readings are much more regular, so there are lesser surprises for people.
Yeah, I will just add one point. So the Jalasathis, they are acting as a interface
Yes.
between the ULBs
Yeah,
and the citizens.
right.
So the one very quick findings, if you go to the field and visit any citizen, they will tell you that now we have someone whom we can report the complaints.
Right.
And they are resolved within a day or two time.
And I think
So
also this is a reflection of our ownership. When we were
yeah,
talking about the decentralized participatory approach, this is an example towards that.
yes, yeah.
We've all seen images of women taking their matkas and going in front of panchayat or municipal offices. But the Jal Sati is the connect which has transformed the situation from an adversary to a mediator, and then hence a collaborative working for both the government and the citizens. Yes.
Yeah, I visited that location exactly just 2 months before,
Oh,
and
wonderful.
I really appreciate the kind of the conceptual framework and the interlinkage and the interface between the ULBs and the customers. So in the long term, I think what she has made a point is that it's not only the flat economic calculation, the financial return and the collection as a revenue only. It's the kind of the trust that Odisha government through WATCO or the service provider for water supply has been regaining the kind of that reliability kind of thing,
Right.
right? That is one point. And the second point is there might be unintended outcomes, like you said, that needs to be explored because it is due to their work, so that that return is there. Second point. And the one, please do not take it the other way. It might be very critical. As I see the kind of monthly income, so just for curiosity, what is the monthly basic salary for any Indian in India? So has it been compared from that perspective of working hours as such, as per the labor law or labor act as such? So that is my concern.
We have assessed,
Yeah, sure.
and that's a very valid point. Thank you so much for bringing it up. There are several cities where you don't have enough volume. So, despite working 4 hours, they're able to earn lesser than the minimum wage equivalent also. But what you saw over the larger cities, these are all municipal corporation. That is much more prevalent in smaller municipalities. And that's a learning that we are trying to work and see how we can help the Jalasathis do a little more work within those same hours so their incentive structure can be relooked at, and hence there is some equity established. But yes, there is quite a lot of variation in that. Yes, please.
Because I've been to that and I can really face that situation,
Yes.
right? Because having a visit of around that number of households per day, I think in the age of this 21st century, I think there are more than such kind of instruments which can track the numeric value if you go along the metering
Yes.
just by walking.
Yes.
So I think that could be a little bit of upgraded rather than visiting house to house.
Yes.
Then those kind of instruments could be used so
Right.
that all the revenue generated could be invested for their efficiency and effectiveness as well.
Yes.
Just a suggestion.
No,
Thank
absolutely fine. Absolutely good suggestion. It's actually been happening. Earlier, they were not, they were collecting cash and they would have to deposit cash, or they were taking the POS machines. But a lot of people were not happy giving, their credit card to put in the, or debit card to put in the POS machine. They were still wanting to pay cash, which meant that this Jal Sati had to manage all this cash. What government did is government gave the Jal Sathis preloaded cards, credit cards, and then whatever cash she collects, she taps that preloaded card onto the machine, and the government directly gets, and that cash remains with the Jal Sati. Now she doesn't have to run around in the banks keeping account and keeping a track and doing the deposits on behalf of the government. So that was one step. Like that, there are several other steps that are being taken. RFID based meter reading, that perhaps should happen in the future. Navi Mumbai did it 10 years ago. Several other cities are doing it. Uh, right now, it's a manual process. Not all is great. There have been cases like Chhatarpur cluster, a region in Odisha, where there were gender issues. People didn't see, they didn't like the fact that hamare mohalle ki women in our neighborhood are doing house to house money collection, and what they did is they gave them the adjacent wards. The water companies gave them adjacent wards so they don't operate in that. There was some social stigma attached to it. So there have been mixed cases, which meant if you're going to the adjacent ward, it's 2 kilometers away, you have to spend money on transport now, or you walk all the distance. So there are these, as we are going along, there are these things that come up, and solutions are being thought of. And he's shown me the time is up.
Yes, the time
But we'll
is
be
up.
happy to
Thank
have
you.
conversations after the session also. Thank you so much.
Thank you guys very much. That was a really wonderful and concise presentation about a really effective method. Next, we will have Srijana Karki presenting. She's a senior development professional and female entrepreneur with over a decade of experience advancing gender equality, disability, and social inclusion across WASH, human rights, and humanitarian sectors in Nepal and South Asia. Her paper is Women-Led Private Sector Innovations in Municipal Waste Management, a case of Batawaraniya, Sundar, Nepal Private Limited, Butwal, Nepal. Thank you.
Namaste, everybody. As she has already mentioned, today I'm going to share one of the success story in case of Nepal, where the women are managing the solid waste management in different part of Nepal, especially in the 7 cities. I'm going to share about that. In the presentation outline, I'll be sharing the major the background of this story, the organizational overview, objective of the initiatives, operational model, how the company is working, and what are the key outcomes and achievements, as well as key challenges and some strategic recommendations and key takeaways. As we all know that this rapid urbanization is increasing, not only in the Nepal, even in the South Asia, and that urbanization has also increasing the rate of managing the waste, and even the waste collection and processing remains very limited and inefficient in the Nepal. And also there is the significant gender gap in the leadership, especially in the waste management sector, because it's more male dominated in the case of Nepal. And in average, women manage over 80% of household waste, but their contribution is still informal and they are not in the much more in the leadership role as well. And women entrepreneurs face limited access to finance, contract, and the fair procurement. Here is the very weak, what to tell, it's politics within the city. And next is like the limited capacity of operationalizing Xerxes within the business sector as well. As in the development sector, we talk more and even we have done many more things, but in the business, it's not as much as we discuss. And next thing is like Xerxes is treated as an odd only. It's not a core business strategy. So it's like just counting the number and it's like only the token in the business sector. Discussing about the organizational, it's the women-led company. Actually, the 3 leaders, women, we have created this company in 2013. And within this company, right now, we have 300 plus staffs. Among them, we have 50% of the women staffs, and among them also 45% are the migrant worker. That means within the country and border country, like from India, also many sanitation workers are working in within our company. And next thing is like we are working in this inclusive PPE model and gender responsive model. It's not 100%, but we have been initiating this work. And we are more focused on inclusive community-centered waste services. And also we link the WASH, gender, livelihood, and climate resilience while working or while managing the waste, solid waste. And the objective of sharing this case study is to showcase the innovative gender-responsive waste management practices under inclusive PPE model. And next is to examine how the government support, community engagement, and private innovation create a sustainable system in waste management. It's, we are working on it, so I want to share this. And next is like to, is to contribute the circular economy, resource recovery, and women's economic empowerment as well. If we talk about the model, this is the major thing that what we are doing is like we are working in the 7 cities right now. We are not covering all the cities, but within the cities also, some parts, some communities have been assigned by the cities to work on those community. For that, municipality is providing some specific land to manage the, or to, what to say, it's like dumping, not landfill site. They have given the land, and they have provided few vehicles, not all, but few vehicles have been provided by the cities, and some infrastructures, like most of the development sector in the earlier past years, some infrastructure have been developed, and that is now it is used for the processing and other things. And also the city is providing the different OHS and other trainings in partnership with the different development sectors. And the company, what we are doing is like collecting the segregation, and we ensure the safety of the sanitation worker, especially the solid waste management worker, not the dislodger, but we are much more focused on the solid waste only. And even in this model, the communities and community-based organizations are there. Many organizations are there within. There also the youth clubs are also involved. What they are doing is they are conducting the awareness program. Every weekend they have the cleanup campaigns, and even some behavior change campaigns also they are conducting. And in this way, we are working in very close coordination. Not only the private companies involved, but all the sectors are involved here. And what are the new things? Not new things, but something what we did extra was like collection of organic and inorganic. It's also the new thing what we are practicing in certain communities of the cities. Like in the weekday, 2 days organic, 3 days inorganic. We collect those things. And next thing is like we are doing composting practices. Like for this, the municipality is providing the different training for rooftop farmings and other composting training that has been provided to the women's groups and other even the male group. They are trying to use the organic waste of the house themselves in the household. And next thing is like even the company, we have done some MOU with the private big companies like the plastic recycle companies in some cities. Whatever we process the plastics, we provide them the materials and they will pay for that. This kind of practice is being initiated. And next is like waste to resource entrepreneurship also. Some mothers groups have been making some souvenirs and other things, like very many minimums, not much more. And here the greatest thing is like mothers group, toll-led organization. It's the organizational community-based organization which is formed by the city themselves, and youth club as a change agent for recycling initiatives. And next is like very rarely in the Nepal, there is the practice of sanitation worker and organization or whoever, very minimal practice. It happens the regular meeting, but we are doing that. We are doing that. And next thing is like we are providing the psychosocial counseling and PPE support for our staffs as well, and door-to-door services for informal settlement as well. This is the new thing that we are doing. And even for them, we have very subsidized user fee as well. Like in the other community, we collect like 100 rupees. Then if in the informal settlement, we just take the 50 rupees for those community. We have that practice as well. And safe timing and lightning for the women collector as well. That is we have practice. And regular health check-up and all the costs are fully covered. Here what I want to focus is like, as I have mentioned you already, that 40% are the migrant workers because they don't have the documentation like citizenship and many more things. Due to that, we are not able to do the insurance of them. So that what we have decided is better to, whenever they feel sick, they will go for the, we'll do the treatments, and even we cover the all the fee from the from our company them ourselves. This is the practice, and even this is costly, although we are doing this in the practice. And next thing is like payment of wages is as per the Labor Act of Nepal. It's fully being implemented, whether in day basis or in the monthly basis, but we are following these rules. And this is even, it is mentioned clearly in the, while doing the contract with the city as well. And what are the real outcomes of these initiatives? It's the reliable municipality waste service is being implemented, and the less waste to the dumping sites, and even community and youth are engaged for the waste management, and women in leadership role for the solid waste management. In case of Nepal, I can say that only 3 ladies are there who is managing this kinds of company. Most of them, they are male, are leading these companies. And next thing is like women's economic empowerment. Like we can see the very good example from local products from the West is being ensuring its reuse and utilized. And occupational health safety of sanitation worker is also been ensured. And one of the story, many of the stories, one of our lady, she was, while working, she got the pregnant, and after she has delivered, we provided her full base maternity leave, and even the work flexibility and everything we provided. Now what she is doing is like, she is starting her own business. She has that much confidence, and even she mentioned that while working with the women's lead company, it's somehow different. So she has initiated her own some small scale of business in the household, and after seeing that, other staffs are also motivated to do such kind of work. This is one of the just story that I want to say. There are many stories like this. And the key challenge is, this is the most tough work. Although I have shared lots of initiatives and innovation, but there are many challenges here in the way. Like while managing the waste, every time the city, they call the biddings. Even there we see the gender bias in biddings, procurement for the solid waste management, and even the limited financial incentives and unclear supports from the cities are there. Due to that, we are not more confident, and we are really not confident to invest on that in the infrastructure and any other things. And even though we don't have the ISO standard landfill size or technology for the solid waste management, it's more about traditional type. And next, another biggest issue is like the migrant sanitation worker, they face much more challenges in the documentation issue. After that, it's very difficult them to manage and involve in the many sectors. And limited inclusion of those workers in the worker unions, networks, and decision-making platform as well. And the key recommendation we have provided, we would like to provide, just I'm going to complete, is like institutional recognition for the women-led companies, and inclusive PPE model, which is like focus and the JETC principle within the government procurement and PPE policy. It should be clearly mentioned so that it will be much more easier and comfort to work. And financial and technical support in the waste processing and recycling technologies. And next is to develop a dedicated national policy for the sanitation worker, including migrant. As we are in the South Asian country, I think this topic should be discussed now, because from Nepal also many people come to the India, and from India also many people are going there. But this should be the agenda to be discussed in the coming days, I think. And even for them, the covering rights, wages, safety, and social security as well. And for the South Asian, as we are in the common platform, what we want to work together is like the community engagement is the central to the climate resilient solid waste management, inclusive PPE model in the solid waste management, and link climate action with livelihood of community is the must thing. And next is regional framework for migrant sanitation worker rights. I think we have to work on this as well. This is the need of this scenario, I think. And next is the regional platform for the sanitation worker voice as well. Okay, thank you. Although the time was over, sorry for that. Okay, if you have any question, please, I'm here.
Which out of the 4 strategic recommendations would you choose, if you had to choose one on basis of priority that should be fixed, or which you need urgent help with? Which out of these 4 would you choose that would help you the most?
The last one I would say, because the worker, they are directly working day by day, but it's very being difficult to get services, facilities for them, for the, like I told you, the insurance and other thing, it's being not possible due to the citizenship and other thing. The last one I'll say, the urgent need that should be done.
Thank you.
Thank you.
Even though you mentioned about what happens to the waste after it's collected, like there is some, you mentioned decomposition and all, but I would like to know how much of the waste collected actually goes to the landfill or the incinerators that is happening. Like what happens to the waste after it's being collected?
Actually, we don't have actual fact data, frankly, I have to share you. If we say the national data, what we see is like only the 50 to 60% is the organic waste and other is inorganic. What it happens is like remaining the plastic and its inorganic waste. Within that waste also, all the materials are not being used as a, for the recycled material. So it's need to be segregated from there as well. We would say just 30% only. Remaining it will be not used. It will be go for the dumping site again.
Thank you.
Do we have any more questions? Yeah. Oh, yeah.
One question: do you need a license from the government to do the? And how much does it cost?
Actually, it's not licensed. What to say? It's we have to register our company, and after that, again we have to affiliate it within the city corporation as well. But we have to pay for that. Every year we have to pay, and it's compulsory. Without that, we cannot renew and continue our work. It's the criteria. To get the work, we have to be renewed and pay the government tax and everything.
Then I'm sorry I joined late. I might have missed out on it. So then how does the community exactly earn the funding or earn the money to pay the taxes or something? Because as you mentioned right now, you have to pay taxes to the government, and every year you have to pay exact amount of fee to keep working. So where does the community get that, earn that money?
Actually, not community they have to pay, the we have to pay, the company have to pay, not community. Community they will provide the money while of their service only. Like every month we will collect, every day we will collect the waste. For that they will pay certain amount of fee for us, but the other fee to the government the company will provide, not company, not community.
Community.
Yeah. Okay. Okay. I think she has final now.
All right, thank you so much for an enlightening session. We'll take.
Oh, can I sit here?
Yes, yes, go ahead.
Okay, thank you. I think
Thank
you are going to ask me. So
No, no. The time is up. We have to move on. Thank you. Next, we'll have Xerxes Rao from UMC presenting mainstreaming climate responsive water and sanitation systems for planning resilient cities, along with Archana Goswami, who was introduced previously. Thank you.
Center. And this is something what we started as climate Chennai Climate Action Plan is something what we did in post that the third master plan for Chennai was being developed, and this is where we thought it would be a good way to mainstream climate action into a master plan, since it's a statutory planning exercise, and there is an act which supports this entire process, and this is more effective in terms of implementation and enforcement across the city. So we did that entire process for the Chennai Metropolitan Development Authority, and we worked very closely on the CCRA, that's a climate change risk assessment for the entire city across different sectors and different themes of climate change. And this is one small part where we tried through a lot of mapping exercise, very heavy data intensive exercise, and then converting that into different maps to see where the wash services are really being impacted across the entire city. So yeah, next please. Yeah, so yeah, next we can just go directly to the yeah. So this is the entire area. What you see is the Chennai metropolitan area, the outside, and what you see in the initial yellow part is the Greater Chennai Corporation area. So we have a total of about 1200 square kilometers area which we are looking at. And how do you really define these things? And then we had a framework of doing the entire baseline assessment. Then the CCRA, which was a main part of this entire process of how you really look at the risk assessment across various sectors. And here we'll be talking more on the WASH perspective of it. And then having the entire strategies being done. And then finally the monitoring and evaluation. So as I said, it's quite a data-driven exercise that we did. So this is also one major drawback for our cities, where that was also a discussion in the morning, that what sort of data do you need? The city does ask you of whether it's for a budget or a grant, then we'll give you a different set of data. If it's for something else, we'll give you different. So similarly, we had to really deep dive into each of these different parastatals and different departments across the entire state to get this data, do the mapping. So mapping was one of the major GIS mapping is what we did to bring in the entire risk assessment. And also stakeholders is one big perspective that we got. So each and every stage we started consultations with different institutions, government organizations and all. Yeah, you want.
Thank you, Xerxes. So as Xerxes has introduced that our objective was to mainstream the climate actions in the master planning process of a ULB. So because what we understand is that the master plan is a statutory document. So if we want to implement any of the strategies at a local level, then master plan is a very convenient and useful tool which we can use. So with this objective, we decided to first, the framework he has already explained, but I will go with each step. So the first step was to understand what are the hazards which are affecting this region. So we listed all the hazards, and then there was a hazard, climate change hazard assessment, which was done using the C40 tools available online. And we came up with these 5 hazards which are very severe for the Chennai region. So again, the next important step was to collect all the spatial data as well as the quantitative data, because this is a completely data-driven methodology. So we required to collect the data regarding the occurrence and frequency of the hazards, then what are the impacts at the spatial level, as well as the quantitative data also. After collecting this data, then again the analysis was done in 2 parts. So first was the spatial analysis, and then there was a matrix analysis. To understand the spatial impacts, to complete the spatial analysis, we also had to prepare base maps. Base maps for all the hazards. So this is an example of the flood hazards. Out of the 5, I'm giving an example of the flood. So for the flood as an hazard, we tried to understand what are the inundation levels for the different return periods. So we categorize them into 3 types. That is low, when it's a low impact, the inundation is less than 1 meter. And then moderate and high flood impact. So all the base maps for all the 3 levels were prepared. And then we also prepared maps for the infrastructures. Like if we talk about the water and sanitation infrastructure, then we try to understand and put it on the map that the locations of the water distribution stations, water treatment plants, water sumps and STPs and desalination plants. So now we have 2 layers. We have a base map of the hazard and we have the infrastructures also. And when we overlay this, then we can definitely understand which one is going to be affected. Okay. So these are just some maps showing how the different infrastructures were located across the study region. We also mapped the health centers, health infrastructure, because that is also important for the WASH sector. And when we look at the local areas or the ward levels, if we go deeper in the ward levels, then we can understand the percentage of these infrastructure which is being affected due to different hazards. So this is just an example of the flood. We can do it similarly for the other hazards also. We also looked at, or we were able to make a list of the different infrastructures which is in the high risk areas due to the flood. We also overlaid the population. So before doing this, we divided the entire region into grids, and 2.5 by 2.5 kilometer grids, the entire region was divided into these grids so that we could go to the local level, to the manual levels. And then we came up with the most hazard prone areas. We did it for all the 5 hazards, and then overlaying all the 5 hazards, we finally came up with the spatial impact overlay of 5 critical climate hazards, so that we can point out which are the very high and high impact areas throughout the region. We then conducted a stakeholder consultation to validate this study. The stakeholders were divided again into different groups, and each group was given one hazard, and then they were also provided with the data regarding the risk, impacts, and what are the indicators, so that they can come up with a score. So the score is given on the extreme right side. So the score is based on the intensity, frequency. Based on the score, we came up with this radar matrix. So this was also again prepared for the 5 hazards. And finally, we could understand which are the sectors and what are their highest scores. So that our next objective was to understand and to come up with tools which can be used to implement the strategies. So then again, we go with the macro level tools and micro level tools. So because these are the important parts of the master plan. So when we talk about macro level tools, we have to come up with some guidelines, zoning regulations, and development control regulations. And at the local area plan, which are part of the micro level tools, we can address specific development needs. So finally, we come up with the strategies for climate responsive master plans. Yes, so we understand that this can be taken to other cities, and there it can be done in the 3 important steps. First is map the invisible. We can use the GIS overlays and for all the hazards and the assets, and map the assets also. Then we have to prioritize the vulnerable areas and the vulnerable communities. And third is integrate them and come up with the climate actions. So this is just an example of one sector, and that is WASH, which we are presenting today. We can also talk about other sectors and other hazards. Yeah. Thank you so much. Yeah. Yes, we are here to. Any questions? Yeah.
Uh, what was the goal of the stakeholder meeting and what came out of it? I was unable to understand it. थोड़ा सा जल्दी हो गया मेरे लिए.
Okay. Yeah. Fine. So the analysis was done in 2 different themes. One was a spatial analysis, and other was a quantitative analysis, which we call it matrix analysis. Okay. So in the spatial analysis, all base maps were prepared, and the infrastructure was overlaid on those base maps. Okay. So these base maps also were presented to the stakeholders, because the stakeholders are from that local region. Different organizations as well as some citizens also were invited. So the citizens could understand that which are the most hazard prone areas in their city, and they can validate that. So this was first part. Second part was understanding the scores, coming up with scores. So if I tell someone that the flood is occurring every month, and the air pollution episodes, they are occurring once in a year. So it's once in 12 months. So definitely I will give more score to the monthly occurrence.
Okay.
So like that, we presented the frequency and impacts for all the hazards, all the 5 hazards which were listed, and the stakeholders were asked to give a rating.
Okay.
So whichever hazard received the highest rating, that was again validated with the spatial data. We compared both of them, and then we finally come up with the most hazard prone grids.
Oh wow. And so will this be put forward with the government so that they can
Part of the
part of
existing master plan that's being done.
Oh wow.
So, as a part of this preparing a master plan for this climate responsive sanitation systems, I was just checking that in Chennai around 25 to 30% population lives in slum. So, any particular highlights or components that you are considering for actually, because they are most vulnerable to all kinds of disasters or all those things. So, any kind of solutions that you are going to considering on providing, particularly from slum population, if you can highlight.
Similarly, we did it for the vulnerable populations, which is the fishermen areas where they stay and the slums both. So that again, I mean, we just shown one part of it because you're talking about wash specifically, but similar exercise was done for the slums themselves, in which slums are going to be really under 1 meter, where they are based out of. Some of these were near the Palikarnika marshlands also, where we said it's a low-lying area and it will be about 2 to 3 meters. We have seen flooding in recent 10 years, it's been 3 times that Chennai has been flooded, So all these things have been taken up, and one of the maps that you saw was from a study of the 4 river basins across Chennai also, which is part of this entire study. So it's a very comprehensive study that we have done, and all these things have been taken up. So we have a separate report, but we can share it later when you.
Thank you.
I wanted to ask how they agreed to integrate this sort of methodology into the master plan. Like, whose idea was it, and how did you approach them with it, or did they float something asking for it?
Yeah, when the master plan started, I would say this was more like a political will and a bureaucratic will, which happened. So the person in charge, who is an IS officer, he himself is a planner. So that's one of the reasons where this entire thing happened and it was pursued. So out of a lot of different assistive studies, this was one of the studies where it was done. And this became the part of the entire master plan that they were going to do there. So of course, without a political and a bureaucratic will, things of this sort will not really move into the systems there.
Thank you.
So I have one quick question. So like, is there a guidebook or some steps which we need to follow? Because there are some cities which we are working now which are flood prone. So like, if we can map certain areas or something like that, like how do we go about this? Like, I got an idea about this, but is there like a step like thing how we go about this?
Yeah, so this is turned into a framework sort of a thing now. So we can share that with you, and maybe we can just do a stepwise CCRA and then take it into the strategy part of things.
And what softwares were used for this?
It was GIS.
Only GIS.
Yes.
All right. Yeah. Thank you so much.
Thank you very much. We'll move now to Dr. Anuj Gorpade. He began his journey as a civil engineer, then embarked on a PhD under the supervision of Professor Pradeep Kalbar, with research that yielded innovative solutions for improving the performance of water supply systems, and then co-founded the startup Ajivam Water, which aims to revolutionize water supply conditions. Water supply conditions through innovative structures for practical use. He's presenting reliable and equitable water supply through innovative hydraulic isolation structures. Oh. I didn't know that. All right. Sounds like it would have been an interesting paper. Let's move. Then we have one more presentation today, which is Vanshika Bajaj, who is an architect. Vanshika is here? Yes. Who is an architect with a specialization in urban regeneration. Her expertise spans research, spatial mapping, and policy analysis. And she is currently a research assistant with the Sanitation Capacity Building Platform at the National Institute of Urban Affairs. She'll be presenting landscape assessment of occupational health and safety of sanitation workers in Vikasnagar and Haldwani in Uttarakhand. Welcome.
Good evening. Good evening, everyone. My name is Vanshika. I represent the National Institute of Urban Affairs, New Delhi, and the study we are going to present is titled Landscape Assessment of Occupational Health and Safety of Sanitation Workers in Vikasnagar and Haldwani in Uttarakhand. So this study today is structured in a way that first we'll try to understand why there was a need for this study to take place, and then what we found on ground, and then how it feeds into the policy taking it forward. So to begin with the brief context of the state, Uttarakhand is urbanizing rapidly at a rate comparative to the national average, with an annual growth of 4%, which is greater than the rural growth there. And due to this unplanned growth that outpaces planning and resource capacities, there have been challenges such as concentrated low-income settlements, strained equitable access to water and sanitation, and rising waste volumes. Also, the waste volumes from 2016 to 24 have exceeded from 1400 TPD to 1631. And in terms of liquid waste, the sewage generation is more than the treatment capacity in this state. And to see that what all of this waste management is dependent on the sanitation workers, and the numbers here are very underrepresented because in the Namaste portal, in the Suraksha Shivir board, we don't find the exact numbers which are there in the state of the sanitation workers which are working there. Also, in terms of the waste pickers in Uttarakhand, there are 1083 waste pickers which have been identified, but only 977 have been registered till now. So now coming to the need of the study, there were three main triggers which led to the study to happen. So the first one was that there is a persistent occupational risk and safety failures. A CAG audit in 2022 found out that there are systematic gaps in PPE use and unsafe working conditions, and recent fatalities of sewer and septic tank workers in Nainital also led our focus towards the study. And the major issue arising was that the waste pickers in the state, they are not being recognized, and also there was a suo case in the High Court of Nainital which focused on that the living conditions of waste pickers are extremely poor. And the third one being that there are some reforms, but these reforms are fragmented, and out of 100 ULBs, only 35 ULBs have received the safety certification under SBM 2.0. So uh, against this backdrop, the aim of the study was to assess the occupational health and safety risk in sanitation workers, including sewer and septic tank workers and waste pickers. So we have seen a lot of studies which focus on sanitation workers which deal with solid waste, but we in this study cater to liquid waste, also the waste pickers, which are the major chunk of the informal workers working. So this study was done in collaboration with the Uttarakhand Development Directorate, because NIO works with the government of Uttarakhand under an MOU. And one of the objectives of the study was also to find challenges and also the opportunities to help these, to provide actionable recommendations. So the first study area is Vikas Nagar. Vikas Nagar lies in the Garhwal division of Uttarakhand, which is near to Dehradun city, and this is a smaller ULB with a population of around 13,1927 as per the 2011 census, which has doubled up till now, and the floating population is around 50,000. And there is a considerable informal settlement within the municipality, but also around the fringes area. Haldwani, comparable to Vikas Nagar, is a larger municipality where the population is around 2 lakhs, and the waste generation, both in terms of solid and liquid waste, is greater. Also, the informal settlements in the city are near the river, the Gola River there, and also the railway land. So for this study, we wanted to go through a mixed approach, combining qualitative and quantitative approaches. So we started with a secondary review of prior studies which have been done to identify the parameters and indicators for our assessment, which helped us to design a questionnaire. And then this questionnaire was used for cross-sectional surveys, and to validate the findings from the quantitative assessment, we did KIs and FGDs through the qualitative approaches. But the sampling of sanitation workers is a tricky thing to do, because there is a formal sector, but there is an informal sector which is waiting to be recognized. So for the registered sanitation workers, we went through a purposive sampling method in which we approached the ULB, we had the registered list, and we talked to them. But for the informal workers, we did a snowball sampling approach. So we approached few informal workers, and then they told us about, yes, there is a group which lives there, and we went to the site, and then we got to know about them. So this was the sampling method, and then we conducted the cross-sectional surveys, the KIs, the site observations, and the FGDs. So all of this led to the findings, and then these findings were triangulated using the site observations and the FGDs, and then led to the key findings and recommendations which we think of that will help in the policy and practice in Uttarakhand. So the findings are also divided into two major parts here. One is the lack of recognition and institutional support. In both the cities, we found that there is a structured hierarchy. If we see here that the permanent municipal workers are the ones which get more benefits, better pay. Then comes the contractual workers. So they are paid on the basis of per day fixed wages. After that are the outsourced workers. So there is a private contractor which is which works with the municipality, and under the private contractor, few workers are working. And then comes the waste picker category. So these are not even yet integrated within the municipal system. So as we move from waste pickers to the permanent municipal workers, we see through the graph that as their visibility increases, their respect, their dignity, their pay also increases. Because there is a lack of formal employment and registration, so also the government IDs are not issued to these workers. Only 55% of the sanitation workers were issued the government IDs, and in the waste picker section, it's more that only 10% were issued IDs and 90% did not had any kind of registration or government issued IDs. And also in the waste picker section, you can see that number of waste pickers registered by the municipality in the case of Vikas Nagar is only 8. But within Vikas Nagar, we found that there are 40 waste pickers residing in that area, and in the fringes, there are around 400 and 3,000 in different clusters. So since there is a lack of recognition, but there are also barriers to these recognition parts. So the barriers were temporary employment, informal recruitment practices, migratory work patterns, and fragmented coordination among government bodies. And because all of these stakeholders, they work in silos, there is a lack of coordination which leads to lack of recognition there. And also the major chunk of waste pickers and their children have not been recognized and integrated into the system, and that is why they don't have access to many of the government schemes there. So only 30% of the waste pickers and their children, they have access to government schemes. But to an alternative to that, there are NGOs such as Suchetna in Haldwani, which are working with the waste pickers, and they're providing education and support and documentation for their family. Also, we also worked on towards the hazardous working and poor socioeconomic conditions of the sanitation workers. It was found that sanitation workers, they do not, 50% do not own their own houses, and half of them, they were living in the informal settlements or rented accommodations. There was lack of access to drinking water and toilet. And these pictures depict the living conditions of waste pickers particularly, which are living into the temporary settlements, and they do not have access to even community toilets there. Coming to the work front now, and how the safety is being compromised, we found that only 15% of the sanitation workers use protective gears. Other than that percentage, we can see either they're not using it or they use it inconsistently. And in the case of sewer and septic tank workers, so we segregated this data basically because that work is more hazardous. We found that 23% were using protective gears, 46% were using it inconsistently or not using it at all, but 31% were performing their tasks manually, not even using equipments. So when we asked them that why PP is not being used, their answer was that we don't feel comfortable while using PP kits. So either that PP kit is not suitable for the season, not suitable as per their body type, not suitable as per their body size, and male and female bodies are different. So we need to counter to that type of aspects while designing PP kits. Yeah, it's the last like of thing. Then coming to the health issues among sanitation workers and waste pickers. So the left bar graph here shows the health issues among sanitation workers and waste pickers combinedly, and then we'll come to the body pain part. So majorly it was found that the sanitation workers which deal with solid waste, they are more prone to cuts and wounds, they are more prone to breathing issues, they are more prone to skin infections and rashes. But the sewer and septic tank workers, they were more prone to back pain, joint pain. They were also prone to cuts and wounds and breathing issues. And when we come to the waste pickers, because these are not even using gloves for segregating or collecting waste, so they were more prone to cuts and wounds, burns, skin infections, and because body pain was one part which was common in all the categories here. So we also segregated that data, and we found that major issues were in the back, hands, knees, and in the hips. So this depicts that what kind of activity or what kind of movement they are doing is also related to what kind of pains they are suffering. So when we come to the access to healthcare in this section, so sanitation workers registered with the municipality and dealing with the solid waste, they they have access to healthcare because there are health checkup camps within the municipality, but waste pickers do not have access to that also. And also the percentage of waste pickers which have access to hand washing facilities is less than 10%. And when we assessed what kind of healthcare is being accessed, either government or private, we see the yellow portion here, it's all privately accessed healthcare in Vikas Nagar city, but in Haldwani it was mostly government based. So that is because of the ULB scale and how the infrastructure is being provided there. So at the end, I would like to, this is because we did not wanted to give solutions which can be used as for all the categories at one go. So we take it as a way forward, and we saw that if we need to register and identify these informal workers, we need to do it through a collaborative action. We need to identify people who know these people. So there is a whole chain, like we did the snowball sampling method, we need to follow solutions like that. And we also need to ensure that the PP kits are customized and are being used. And the third point is that workplace safety training should be mandatory with visible signage and infographics on hazards and safe practices. So in this context, NIUA has also prepared a training manual on occupational health and safety of sanitation workers. And also it is important to have training calendars and categorization of trainings for different workers. Regular health checkups, strengthening of social security and legal identity and housing access, break the intergenerational entrapment through education and livelihood diversification, because there are children of these workers who do not want to continue with the occupation. So we should be providing them with some options which they can access. And the last one being to improve workers' representation, inclusion, and accountability. So there is no worker grievance redressal system in both ULBs. So they don't have a place where they can reach up to. And their representation in sanitation planning, and there should be convergence between schemes and departments so that their voices are being heard. Dignity and governance. Hence, it needs to be addressed through collaborative actions. We need to identify the right people and we need to integrate them into the registered system so that all voices are being heard. Thank you. Any questions?
So, thanks for the. We have very few cases from we in India. We have very few cases that come from the hill states. So it's a great thing that you have started capturing these conditions in the hill states. Having said that, one of the things I wasn't clear, just for my clarification, was how was health data captured? Was it through a recall method, just asking them what kind of issues did they face? Because that comes with a whole set of limitations. That the recall period generally functions only for the last 15 days or max up to a month. Yes. If you are trying to capture it for an entire year, it completely fails to capture all the kinds of issues that they had. Second was seasonality captured, because seasonality in waste is a big thing. Say monsoons is the off season, particularly for rag pickers. Even the composition of waste changes according to the seasons, and so does their patterns of how they collect and what do they collect, and which is again linked to health. So these two things I would want to know a little more. Amongst the rag pickers, at least in Ahmedabad, the case studies that we have done, there's a whole section within just the rag pickers. I'm not talking of the formal waste sanitation workers. There's a whole category of typologies that we have found that there are people who collect at specific locations. There is another set of typology that looks at they collect niche, only certain types of waste. So was there some segmentation done within the rag pickers? Because if you present the data like that, it may give us more insights instead of clubbing all of them just as rag pickers. Thank you.
So to answer your first question regarding the health hazards, so we did it based on self-reported data within a period of 1 year. So this is one parameter. And the rag pickers, which we did the categorization. So right now we were looking at the sanitation workforce as a whole. So we divided it into solid waste, liquid and waste. But for waste pickers, we did not make categories as such, but that is definitely a scope of work for our future studies in this sector.
I guess building on Murphy's question, did you do any kind of gender analysis? Gender, did you look at gender?
Gender, did you consider gender in this?
So yes, so right now what I presented is the initial findings from our first analysis, but we do have gender segregated data, so that we'll be working on in the next year.
My question, because it was the hill districts that you covered, was migration or considered in the study? For example, which state the rack pickers or the scientists and workers were from? And I was particularly interested because a lot of Nepalese from Western Nepal also come to those as migrant workers. Even in the sanitation sector, in Nepal we started to have a lot of the Rohingya refugees as rag pickers. So was that considered in the study,
Yes.
or is there possibility?
Yes, sir. So as I mentioned that migration was one of the factor which migration was one of the factor and also barrier to recognition, because the municipality does not want to take responsibility of a worker which is residing in the fringes and has come from a different area. So yes, there were migrant population of informal workers which were from Nepal, yes, and from Uttar Pradesh, from Punjab, from Haryana, because Uttarakhand and these two cities in particular, these are in the foothills and they are the major trade centers. So yes, there is population residing in that.
I think I missed it if you have mentioned it, but I would like to know what the sample size for the study was. Also, um, uh, like you suggested a way forward. So I would like to know if there are already some worker unions or any NGOs already working on like betterment of their health. Uh, and if not, then could some of the issues be solved by a participatory approach by the workers?
So there were total, so I'm answering your first question. So there are total 1024 workers registered with the ULBs in total for both cities. So we conducted 111 surveys. So that was our sample size. And to answer your next question, I mentioned in the presentation also that there is an NGO called Suchetna, which is working in Haldwan in providing education to the rat pickers children there. So yeah, collaborative action is very necessary here because NGOs are in direct contact with the workers there, and they can be a great solution in integrating them with the ULB, because ULB does not have that kind of data. They do set up camps for registration, but that do not work very efficiently on grounds where informal workers are living in population of 2000, 3000 clusters. So yes, NGOs are there and they're working in Haldwani particularly, yes.
Thank you.
Thank you.
Really came out of this is that none of these problems are very clear without multiple modes of engagement, both in terms of the implementation, because all the practices require reliance on a multiple networks, on NGOs, on private companies that have better ethics, and on municipalities that are ready to engage new technologies and work with communities. And I think the successful things that we're seeing are where the sort of fear of failure or the fear of being overlooked or accused is bridged by better communication, which comes back to the need for better information. So it was a wonderful session. Thank you to all the presenters for bringing these ideas forward. Thank you for everyone for listening. I don't think we have much more time. If there's anybody who has a general comment, you can give one. Otherwise, we'll break for the next session.